Hi, it's Mrs. B. Today we're just going to talk about compression stockings. There's a little PowerPoint in your Schoology classroom under Mrs. B's videos and lessons about compression stockings. I wanted to talk about a few key items here. You can see that we have our mannequin in the bed and he is presently wearing a compression stocking. That is a thigh-high stocking. Also, you can see that I have his one leg without the stocking on bent, showing you where the knee is, where the ankle is, and you can see that you have the package over here that the stockings actually come in. I'm going to go a little closer, try to be as steady as I can. This is a pair of knee-high stockings, and I'm just showing you a little measuring tape that's reusable that measures inches, and one of the disposable measuring tapes as well that you can use. So what you're actually going to be doing is checking what size your patient has. This is a brand anti-embolism stocking by the company called Care, and they have all different sizes. They have measurements for knees and knee highs and measurements for thigh highs, and they talk about how to measure for proper fit, okay? In the little PowerPoint, I mentioned how to measure, but before we get started with even measuring your patient for the stocking, I wanted to talk to you about a couple different things. These stockings are very, very elastic. They're very tight, and they actually are used for the purpose of promoting blood flow from the lower extremities back up to the heart. So you have to make sure that you're washing your hands, your hands are nice and clean and dry, and that the nurse or caregiver doesn't have any jewelry on, and that your nails are short because you don't want to cause any kind of scratches or skin impairment. Our mannequin here is shown with the head of the bed almost flat with just a very small pillow under his head, because you want to make sure that the head of the bed is down to promote the blood flow back to the heart before you put the stockings on. Also, prior to applying the stocking, you want to make sure that there is no visible skin impairment. You want to check the toes, the ankles, the bony prominences of the skin before you put on the anti-embolism stocking. And you also want to make sure that after you put that stocking on, that there's no folds, there's no wrinkles, and that the whole thing is smooth, because you don't want to restrict the blood flow that is supposed to be promoted back to the heart by causing injury just simply by putting on that stocking. So compression stockings are socks that are manufactured, and they're supposed to support lymphatic drainage and veins in your lower extremities. It's supposed to help and promote the blood flow back to the heart. And they're also available in all different sizes, all different types. There's different colors. It depends if you're ambulatory or not. Sometimes you can have them, they come in black, they come in blue, skin color, white. And generally, medically speaking, when you have someone who is in-house, there is actually the open toe up the top. And that's to monitor the circulation, make sure that you can feel the pulse, the dorsalis pedal pulse in the top of the foot, and that they're circulating very, very well, that you're not having a lot of edema, or there's no discoloration or changes in the circulation to report. So when they're applied correctly, they actually squeeze the leg from the ankle to the knee, and they help to prevent blood clots. Many times if a patient is on a blood thinner and they had surgery and perhaps they have to have either a lower dose of an antiplatelet or a blood thinner, they will be ordered to have anti-embolism stockings on when they're in bed and they're less mobile. Certain conditions such as a stroke or post-op, say somebody is elderly and they fell and they had a fractured hip, they were awaiting surgery, they may add protective stockings, anti-embolism stockings, to prevent blood clots. Usually these stockings are worn for 23 out of the 24 hours of the day, because you want to be able to remove them for bathing for observation of the skin, but in between shift to shift, you also want to observe the skin for any kind of an impairment. Also, just follow along with the PowerPoint that I provided for you guys. Gives you a little idea of exactly where to measure from. And you can see that our mannequin is actually having one leg exposed. So you want to measure the circumference of the widest part of the thigh. You would go down, I believe they say 4 or 5 inches from the groin area, and then you would measure that area. Your calf, to measure the size and circumference of the calf, you would measure in the widest part of the calf as well, and that's what the measurement that you would use. You would measure also above the ankle. Taking all of these measurements into consideration, along with the length from the knee to the ankle, would give you the appropriate size of what your patient would need. Circulation is very, very important. People that are immobile tend to suffer from blood clots, and you want to make sure that you're monitoring your patient in between. So in the skills lab this week, this will be one of the things that we do, will be application of the anti-embolism stocking. I would like you to follow along with the PowerPoint. I would also like you to watch the demonstration video that Maya also provides on putting on the stocking. You can see that we have the privacy curtain pulled because you would want to only expose the area that you're working on, and I actually tucked underneath our mannequin's patient gown so that you don't expose the perineal area, making sure again that the wheels of the bed are locked as always for safety, and that you are protecting your patient and keeping your patient safe. Okay, that's it for today. Thank you very much.